can be a little clunky. I'm making sure that we are live here. So, where are we, Holly?
That's a good question. We've been traveling so much.
We saw each other in
we
another
went to
city.
FemCon in DC, and now we're in Des Moines at Nourishing Change Conference, and
Yes.
it's been phenomenal.
Yes. Okay, good. See, here we are. We are actually live. There we go. Okay. So we were at dinner on Monday night with FemCon, a couple of dinners, and then we both flew to Des Moines, and we're at Nourishing Change. And so Nourishing Change is a really interesting conference, and then I chose, so FemCon is Food is Medicine conference. I know a lot of folks that watch probably are there or may even watch this after the fact. But what was exciting was we were together, I don't know, a month or two ago, and you were like, our report's getting released right the day before I leave for Nourishing Change. And I was like, well, I will be there and we should record. And so here we are.
It is great to be here, and it's really fun to see all the different retailers, all the pharmacies, all the tech companies, all the different stakeholders that make food as medicine work.
Yes. And so I am excited. There's something cool about doing this here versus at FemCon, because you and I and Carter have had many conversations about the report that you've built and the stakeholder map that you've built is a multi-purpose mapping of the ecosystem that can be used both downstream and upstream. And not that they're completely bifurcated, but from an economic perspective, I would say there's different levers. And so what I think is really nice about where we are today is a lot of people tend to focus on food as medicine on the downstream, right? Where the payer's paying for it or the employer's paying for it. But as you and I were talking yesterday, it's upstream. And this mapping, this report really makes the case for, we can redo this. We can make this a sustainable model, and how do you put the pieces together? And we're at a conference that is more upstream, right? Yeah. Retail grocery.
And I don't think it's that we need to redo it.
No, not redo it.
But I do think, though, that the food as medicine time has changed. Like, we're in a new space, a new phase. We needed to build the evidence for the last 5 years, 10 years. We needed the evidence. We needed to know dose duration, what works, what doesn't, what's the population. We have the evidence. We've done 1 million pilots, in this country. Probably maybe 1 million. I was thinking I was exaggerating, but I'm not sure I did. But it's time for infrastructure. Like,
so let's talk about that.
We have to have the partnership infrastructure for success.
Which is to, again, this is what we harp on, is we need to make this a sustainable model. This can't be a permanent grant funded, like, there is a true economic business model here.
Yes, but I'm also, once again, going to push. So I think, yes, we'll get to that part. This report does talk about financing partnerships, the partnerships that are needed to be able to have graded financing and funding models. But what makes this report different than all the others that we've seen, this is about governance, a governance structure. This is about all the 12 different stakeholders, right? And how do they work together? And each stakeholder works with at least 3 to 6 other stakeholders. What are those relationships? And they're not stagnant. They keep changing. So as food as medicine is on a continuum, even when you start a project, so the relationships change. And we know that in any good relationship, there's tension. Absolutely. So how do you get in front of that tension and know it's going to come and be able to preempt it? This report goes into, we have 50 recommendations, and that is a lot.
And so obviously we're not going to cover it in the time that we're here. We're going to do another one. Yes.
But the point is, it's about thinking about, where did we see the tensions in all the interviews that we've done and all this conversations and meetings we've had? Where did we see the tensions, and what are the solutions so that we can preempt them in the future, so that we can get in front of them?
So what, we can pull up the stakeholder map
that would be
for
great.
Folks to look at, but what is like the 1 or 2, because we have an interesting audience. We have a lot of industry, we have a lot of policy, and we have a lot of consumer. And so I'm sure we have, as normal, a mix, and we are global. So I would also say, like, we a lot of times have folks from Africa that join our live streams in India.
Yeah.
So as we're talking about this, I think it's a model that can be used globally, which Milken is global.
So that is what's exciting about this, is because a lot of the evidence-based work is U.S. focused. It's about Medicaid and Medicare.
Exactly.
But this is about the people and the stakeholders.
Yep.
And
So
when
let's
pull up the stakeholder map.
Okay, let's see if I can do this.
Yeah, I'll keep talking while you work on it, okay? So we started the stakeholder map. The first time we released it, I think it was in 2023. And the origin story of the stakeholder map was we were just trying to track all the data exchanges. And so we started to talk to different stakeholders, and then we then created the stakeholder map, and it was originally just about data exchange. And so then we re-released it because we realized that so much has changed and the pharmacies were not a part of it. So then a couple years ago, we did a revised stakeholder map and put the pharmacist in. And this map is by far my favorite, the stakeholder map.
Okay.
And it has expanded. It went from 10 stakeholders to 12 stakeholders, right? It also has like these 5 different domains. You'll see the pictures on here. Participant involvement, right? And so you have like the participant involvement. You were talking about the consumers. Yep. So then there's like the program participant. They can also be an advocate. They can be a FIM navigator.
So let's pull this up.
Yep.
So folks can see. Okay.
And so all those lines in the middle
show
all the relationships.
So what's really funny is, we have Chrysonia, and the visual that I got to on how it is a constellation. So like looking at this now, and it has these lines like connecting it all.
And this is what makes it so much fun, right?
I
never thought I would like a map so much.
Well, it's not like a normal map.
It's not a map. It's a stakeholder map.
Exactly.
It's about people, right?
Exactly.
And so I think that what we've done here is that this is the framework, and this whole report goes deeper. It goes into how do the different partnerships work? What are the kind of models? Are they direct partnerships? Are there coalitions? Are they learning collectives? All these different examples. And I would say that in this report, we highlight, I'm going to make it up, but somewhere around 20 to 30 different examples of hyperlinks of different types of stakeholders.
So where do you want to start? I feel like I want to hear some of the stakeholders, and then and maybe an example. Like, does that make sense? Or what?
I think I want to take it differently. I think what I want to do is take it from, I think this is a moment to kind of, it's a big report. By the way, this is one of our biggest reports. So I want to kind of give you a little bit overview. So
and then we'll do a deep dive.
Sections are rather than going into the nitty gritty of each kind of relationship.
So do it.
All right. So we have 3 key areas.
Okay.
All right. And we have the partnership design section. I actually have to look at my notes because I can't memorize everything on this.
Well, it's a big report.
It's a big report.
So do you want me to keep the map up, or do you want me to go to a different page in here?
So exciting.
It is exciting.
Let's see. Let's go to design partnership architecture.
And that's in this stakeholder map? Or is it in the big report?
Yeah, I think, let's just stick to this. Let's keep the stakeholder map as I think everyone will get too dizzy if we start to move around.
Okay.
So let's just stay here and I will talk.
Okay.
So the first part's on designing partnership architecture, which I love those words, right? And that's a stakeholder map. We've talked a lot about that. But it's also the pieces that we said, the domains, like policy and financing, participants, food provision, right? And fulfillment. Oh my goodness.
Fulfillment. It's been a long week.
But it's been a really long week.
And we've had dinners, and it's
sleeping a few hours a night.
Exactly.
Technology, data, and infrastructure. And I think I want to take a second there.
Yeah.
Because that has unlocked opportunity. So like when we've seen food as medicine in the past,
right?
We did not have the same tech stacks, the same opportunities to connect the healthcare, the health insurance, to the grocery store, to the participant.
So would you attribute this? So yesterday, Amy Gleason was here, who I love, and just did a phenomenal job of articulating how far CMS is trying to move, HHS is trying to move the needle on tech and really opening up for the consumer. So do you feel like that's part of this, or it's more just tech in general?
I actually think that tech, and I am not like a techie, so I'm going to say
I'm a total geek with things.
So. Yeah, so let's understand that. So I think that there's been issues of like the health insurance companies and payers want to know certain information, the grocery stores. And so I think they're really connecting the dot beautifully between like the grocery, food, retail to the insurance company. I also do think that there is this place going from the grocery store to the consumer.
Okay.
And sometimes it's all tied together. And I think that we're going to start to see with food as medicine of the future, right? We're going to start to see stacking of benefits.
Gotcha.
So you could end up, right, with a card that will have, you know, maybe your Medicaid and maybe someday even SNAP, and maybe it's going to have, you know, an incentive on it. But like, I think that we're going to start to see these more stackable models.
Yep.
That's not where we are yet.
Yeah.
But I do think that, or stacking of food as medicine together. Even projects.
Well, I mean, we already have supplemental benefits cards.
Yeah.
We already load some of those. You know, to your point, that base infrastructure is there, but it needs to be enhanced. So what do you think unlocks that next level?
I think we're beginning to unlock. So I think that now we're moving away from the report, but I think we should just go right there, because I think that it goes into the other piece that when we start to look,
I want people to implement the report. So that's why I'm like,
all right. So then we go back to sort of how to implement, because I think we're going to go down a rabbit hole that we may.
We'll do that on a longer conversation.
So I do think that when you're looking at this report and how to use it,
yes,
it's kind of like pick your own adventure. So when you go through the report, there's sections of it that says if you are new and just want to start a food as medicine program, go this pathway. If you are a funder and you really want to see how to fund, go this pathway.
So it's like a pick your own adventure.
It's totally pick your own adventure.
I love it.
If you are like well seasoned, but it's time to formalize, right? And you just kind of had all these verbal agreements and it's been working, but you know, you're trying to grow and you need to get contracts here, or you want to do this.
Yeah.
So there's a place for everyone in this report. And so there's 3 key sections. So the first one is really about what we've been talking about, stakeholder relationships, the different kinds of partnerships and relationships. The second part is about funding. And this is really quite cool, because in the funding section, it's talking about grading. The failure to food as medicine, you know, one of the potential failures and the fragility of it is if you rely on all one funding source.
Absolutely.
And so you can already see, like, if you look at the course of food as medicine, initially it started with a over-reliance on grants, right? Because they were the ones who were going to take the risk. It wasn't well established. You know, that's what happens at first. So that was great. Then we saw this opportunity to really like dive into the waivers. So we went all head
I always
in.
call it, you won't like this, but I always call it like the magical pot of gold of whence these new things come. Like just because I've been in healthcare for 30 plus years. And so I always watch. It's like the pot of gold emerges and then all of a sudden it's like, and now we're going to go there.
So I think everyone jumped and it's also really important and needed.
Absolutely.
So we went Medicaid and Medicare. And so around 2 years ago, I was like, well, everyone's really focusing on Medicaid and Medicare, and that's great. And we need that. But let's think about the employer.
Exactly.
Right? So then we published a report just last year, a blueprint on the employer, on food health benefits, a blueprint for employers, because they too have an important role here.
Absolutely.
And so when you go back to this report, it can be, you know, when you're looking at the funding, it can be Medicaid, it can be Medicare, it could be local jurisdictions. You know, it's the government side. It can be grants. It could be, you know, it can be companies. It can be, you know, financing models. I think there's a lot of opportunity, and the main thing is it has to be braided. And there is actually a little bit about.
So we have this is. So we had somebody actually. We did our nutrition session this morning. We normally do on Tuesdays, but I had some technical issues with travel, and so we did it this morning. And we have somebody here that joined this morning who is giving feedback. So she is saying, I hope you are selling this report to finance your enterprise and mission growth. And so I think it's a good place for you to, though, I think talk just for a minute about Milken at some point. But I would like you to unpack a little bit when you say braiding, what you mean.
Yeah, so I actually think I'm going to have you go into the report if you don't mind, because I think there's 2 places to go. Page 25 is where I think
and
I want you to go.
And I can't go into that summary, right?
No, I don't want you to go into the summary. I want you to go into the report.
Let's see if I can get it into Chrome. And that may be, let's see, hold on.
Because there's 2 pages we're going to go to. Can you get there or no?
I'm going to do one thing and see. It was not being kind with
All right, while you're looking and trying, I will talk to you about the braid.
Okay.
For those of you who have actually opened the report, it's page 34, just for all of you.
Okay. Well, here, let's put a link. Let me do this. Let's put a link. Do you happen to know the link? I can get it. I have it in here.
You should just grab it.
I have it. I'm used to this. I'm used to the fun of the. There we go.
All right, so
Okay.
we're going to start on page 25 then.
Okay.
And
so
then we'll move
folks
to
that
34.
I would suggest anybody here should download the report. I am going to attempt right now one last time just to see if I can pull it up real quick. I'm still getting used to the Mac environment. This is a new, there we go. So now I should be able to share from here. And
Right, you could
bingo.
scroll down to page 25.
It is this, right?
Yeah.
Yeah, there we go. See, I did it.
All right, so you
No
can scroll down to
stress.
page 25. You're on it. Look at that.
Thank you for your patience. Sometimes people jump the gun and they're like, no, let's just keep moving. But we got there. Okay, I'm here.
All right, so you're 25.
Yeah.
I should have a chart looking like this.
Okay, and I am not in 25.
All right, while you're working your way there,
Yeah.
This section is about optimizing funding partnerships for
Here it is.
collaboration.
It is this here.
And so this is not about how to fund food as medicine. That's not
Correct.
what I'm going to talk about.
Correct.
I'm going to talk about the relationships that are needed. So this figure here on food as medicine funding ecosystem, what I really like here is there's 4 key stages: early innovation, right, and evidence. If you're just starting up, right,
Yeah.
and if you're just starting up, like, who tends to be that kind of funder, right?
Yeah.
That tends to be the grant funder, right?
Yeah.
And the purpose is, just to co-design, figure it all out. But as you go through these 4 stages, the demonstration and policy integration phase, well, the funders will start to change, right?
Okay.
And so your funders may go into, maybe you don't need the grant money anymore. Maybe you're using Medicaid, maybe you're doing the waivers,
Okay.
right?
All right.
And you're testing the waters. We're going across each of the colors
I love
here.
this. This is like, I feel like I'm looking at an early adoption curve,
Yes,
but from a
totally.
funding perspective.
And then you have the market development, and we have not gone all the way to number 4, just so you know, but market development and infrastructure. And so then you can look at who the funders are going to be there, right? So that can be private. Someone was talking about money,
venture.
right? Private investments, healthcare
Yeah.
contracts, and maybe some philanthropy, right?
Yep.
And this is scaling the platforms.
Well, we have,
Right?
Doman Foundation
Yeah.
funds food as medicine.
Yeah.
Ardmore Institute, I would say they're more on the grant side, but I
Yeah.
mean, these are organizations, foundations, impact organizations that are contributing greatly to trying to really
Like
light a
SGG
fire.
Ventures,
Yeah,
right?
absolutely.
So we're starting to see that. And then the 4th section is sustainable coverage and systems alignment. And that's where you're going to be really looking at, like, it could be the healthcare reimbursement models, like the healthcare themselves.
Well, so I went
public-private
straight,
partnerships.
just, I went straight
course
to
you did.
4
Yeah, of course you did.
with Aaron. And I was like, we need to get a value-based contract for you.
Yeah.
And then we need to write checks back to the farmers.
And also, it's not always linear, right?
Absolutely.
And so this is really important. And what I like about this is it kind of shows all
like
the different.
multi-dimensional.
It's multidimensional. And I have to say, Anna, who's the lead author on this report, is so
Props to
amazing,
Anna.
right? Amazing with graphics. So I want to then go to page 34.
Okay.
I mean, so much more than just graphics. She wrote the report.
Oh,
It's
absolutely.
amazing work.
Oh no, I was
with Clara,
just if Anna wants to hear this, like I remember I worked
you want to go
for.
there?
Is that where you want?
That's fine. We'll go here first. So what I think
Okay.
is really interesting here is examples of food as medicine partner opportunities, right? But I think I started on my own copy, started even putting arrows. So you see the first inner circle, right, where it's like employers and commercial plans, philanthropy, federal, state, program financing. I'm going around the circle.
Yep.
State and
Over
local
here.
government and healthcare systems, the first circle.
Yeah.
That is a partnership, right? Like we have to start thinking about the funder
Absolutely.
partnerships and how the funders are doing handoffs to each other.
Yep.
Or communicating with each other.
Yep.
And I really loved in this part of the report, understanding it's not just about how do you get money for food as medicine,
Right.
but what is that funder partnership and relationships? So we typically see a lot of the grant funders, they do work together, and they talk to each other
Absolutely.
and they're collaborative. So
just
we're
like
seeing,
venture. I mean,
Right, and
venture
venture.
funds, like they tend to
Right.
stack
But
together.
what we may not have always seen is that circle,
Exactly.
the venture funds and the plans
Exactly.
and the health plans and that partnership model to make sure this one food as medicine intervention, whether it's in one
Yep.
community or across the country,
Well, we see it.
is seeing its scale.
Interestingly enough, you do see it in other pieces of healthcare where those stakeholders are working together and braiding. But to your point, in food as medicine.
So
it's
while
not.
you say braiding, page 34, please.
Okay.
It's one page up, I think. I see
Yeah,
it.
I see it. I see it too.
All right, so this is the braid.
I'm just trying to get it just right. There we go.
And so at first we like a braid, you usually think 3. And so we had 3, and we're like, it can't really be 3. So then we put 4. We're like, oh, it can't really be 4. It has to be 5. And so this is kind of a synthesis of the braid. So this is a little bit about what we're doing on the financing and funding on the partnership structure piece.
Perfect.
So we've now,
and that's just like one piece of the whole puzzle, the whole map. So I do have to say to Mr. or Ms. Singer, I'm sorry, I guess it's Ms. Patricia, I'm going to assume. I do have to say that this report, and I will let you speak to this, but the reason that Milken created this report is actually for anyone and everyone to use as a way to implement, as long as credit is given. But it's just not meant to be like hidden under this is meant to be used. So that's why I'm excited to put it out here to the Substack audience to say, like, hey, if you're in another country, like, here's a map, you're allowed to use it, and it's like really helpful, and base it on that, and then attribute Milken as.
We go even further. So in the appendix, when you make it to page like 88,
should I like go there?
No, don't. But you might want to actually.
Okay.
But we'll just make everyone a little dizzy.
That's all right. I make people
dizzy. It's page 75.
So I knew if they're here, it's okay.
So going back to that stakeholder, we're popping around the report a little bit. But on page 75, you can see that we have created a stakeholder template for you.
Oh, this is awesome.
Oh, and what we didn't get to talk about, like, is Maura and the work in Florida. So she took this stakeholder map, Living Hungry, right?
Yep.
And she took this stakeholder map and automatically saw and said, oh, this is a governance structure. I'm going to write people's names on each of these stakeholder relationships. And I'm going to do it for each county in the state of Florida. Or I don't know if it's county or region.
It's region. She has 12,
I think
12
I don't
13
remember.
regions.
And so then she took this and she had 12 stakeholders in each of the regions, and they all had their names associated. So this became a governance structure. And this report goes into in depth about how to use it as a governance structure. Like, it's like the Food Policy Council 2.0. It's a Food as Medicine Council, like kind of thing, as a governance structure. And then so this template that you can see here is for you to start to decide who's your population, what is your need, what's your approach, what are you trying to measure, and then you could probably make it so that you could move everything around and figure out the relationships and draw your own lines. Yep. So we want this to really be used.
There are people playing cornhole.
Yeah, there's definitely.
So everybody knows we are live on the showroom floor. We thought the one that I am, the crazy one, thought it would be fun to showcase where we actually are. I didn't expect to have a cornhole, and the best is that they're here. I'll let everybody see is and they're all shiny. There's like pretty pink and but these 4, I have to say, like, while you're pulling that up, I do want to say for a second that, like, the folks here, they're these emerging brands, right? And they're showcasing their food. And
I love the chocolate.
The chocolate. The chocolate was amazing. But
I don't mean to interrupt. I just want to say
we're on podcast.
We're live streaming. That's okay, but it's not.
But you know what? Hold on. But that was really great because that's one of the stakeholders in our map. So that was a good example. We're sitting in a place where this was a health plan that just popped up and said, wanted to say hello.
Yes.
And they're actually highlighted in this report.
Oh, are they really?
Yeah, they totally are. I will find you the page in just 1 minute.
Oh, that's amazing. So, we should have had him join. I should have been like,
I think
it would put him on the spot. He would have been like, wait, I didn't ask media if I could do this. But while you're playing, I was just going to say the pink sneakers and the cornhole is these emerging brands have been here.
So page 51. So, you wanted to talk about a relationship tryout.
Yes.
So that just works perfectly because a person just came up to me who is a perfect triad.
Yes.
Okay, all right. So this is the one. This is a good example of a case study. This is leveraging food retail technology health plan partnerships.
Okay.
All right. And this is actually perfect for where we're sitting right now.
Okay. Perfect.
And I can just do high level.
Perfect.
So Hy-Vee, grocery store.
Yes.
Pharmacy, retail, grocery store.
Yes.
Worked with Nebraska Total Care.
Yes.
Medicaid.
Yep.
Right. Population. With Evermore tech platform.
Gotcha.
Right.
Gotcha. Okay.
To do a food as medicine intervention to improve health outcome. right? And so that's a really good example that you can read about it on page 51. And if you look at your stakeholder map, then you can look at, okay, who are all the ones? So when you think about this, you have a retailer, you have a tech, you have a plan. Can't forget the program participant.
Absolutely.
Right, the program participant. You have to then think about where the food's coming from. Well, the food in this case is coming from the grocery store.
Absolutely.
But then where does it come from? Of course, farmers and wholesalers and so forth.
Yep.
So that's a great example of how to use this report. So in the report, there's sections, everything you see in like that dark green,
which
there's
we have one up, so that's perfect. So
there's
those are
always
like the case studies, so that people really understand. And they're case studies particularly relevant to that particular section, right? Where you're really highlighting and digging in to say, this is, as you said, this was the tech piece.
Yeah.
Yeah, exactly.
So that wasn't just the tech piece, but that was around tech, grocery stores.
Right. But in the report itself, I'm assuming there are different, like we've got different sections.
Yeah, and we maybe let's go around a little bit and I'll show you a few. Go to page 21. We're going to go back to the designing partnership and stakeholders because we weren't showing the report when we were talking about this.
Okay.
And this is just to give you kind of an example. This is looking at here is like the learning and advocacy section. And so this is where you can see for those of you who are already well in the food as medicine space, you can see like there's a Food as Medicine National Network of Excellence, Healthcare by Food Advisors. You can see all these hyperlinks. Of course, our task force at Milken, and so that's, and then if you go backwards, we're going backwards. Sorry.
Oh, I see my friend Erin, who I was just talking about.
Do we want to?
Yeah. So I'm going to go
any
back.
Questions or thoughts? So then, Erin. And then if you go to page 19, and then you can see MORA, the Florida Health and Nutrition Coalition, right? Oklahoma Food as Medicine Coalition. So you can just see lots of different examples.
Well, and so I'm gonna actually highlight Erin for a second, which is this co-chaired Hunger Free Oklahoma and Fresh RX. So Erin has a regenerative regenerative ag sourced food as medicine program that's very effective. And she's an example of one that is grading her funding, where she has grant and she has all the way to, like we were just talking about. So she's, if you were thinking about what I was, that visual, right, of the 1, 2, 3, 4, then I relate to Anna. I'm a very visual person and love to create visuals. I used to be known, so I ran strategy for a $3 billion insurance company, and what I was known for is being the PowerPoint queen. I was like, this is not what I want to be known for. It was, but it worked. So anyways, so if we think about Erin, she's got definitely still grant funding that's coming in, but then she went all the way to the far fourth column and said, let's get one of these Medicaid payers that is covering duals, and that has a product, and let's actually work with them to get a value-based contract where it's not just getting payment for the food itself, it's being paid like a provider of care as an intervention and saying, I'm going to pay you an amount of money that covers your food, but then I'm actually going to give you a value-based payment, an outcomes payment, that if you get the A1C down below a certain number and below a certain threshold, right, for every patient that you do that's enrolled in the program, you get a check at the end of the year.
And that's exactly the type of models we want to see.
And then I want to go a step further and say, and the concept is to take that money that comes in and actually give a portion of it to the farmer. So, sorry, I'm very passionate about that.
Absolutely. If you go to page 16, we definitely are going all over the place.
I know.
But this is also another graphic. This is a nice summary of what we were just talking about. So, you direct partnerships, operational backbones, shared implementation, and learning and advocacy. So we were just talking about all the different examples.
Yep.
And then when you go through the report, you can see those graphics throughout to see where you're navigating. Were you able to find yourself?
I am here. It just doesn't want to go.
There you go. So you can see a nice pretty picture there. We're covering the report, go front, back,
it's great though.
Middle, front.
But I like it because I feel like we're doing it in a manner that actually gives examples. We're not just doing it on a parochial level.
Yep.
There we go.
So, and then when you see that, this is how we probably should have started, right? It's like, and then you see all the examples that we were just talking about a few minutes ago. Examples of learning networks, examples of different models. So I just wanted to kind of anchor that. So now, if you don't mind, we're going to jump because we're probably wanting to get closer to the end than the beginning of this conversation.
Absolutely.
So we're going to go to the third and last section of this report. And I have to give a shout out to Clara on this one because she did a phenomenal job working on this section, particularly on the building shared understanding and long-term value.
And so you're on page.
I'm on page 48, but I'm going to try to figure out which graphic I want you to see here.
Okay.
I might just talk for a moment.
Sure.
Yeah, I think I'm just going to talk about one of my favorite parts.
Perfect. But it's in this particular section.
In
so
this
if I'm
section,
if I'm here with this chart.
Yeah, hold on, I'm going to get, give me a second.
Sure.
I wasn't ready to go through the whole report, so let me just find, oh, this section actually has a lot of pieces in here. It talks about all the different tensions.
Okay.
All right. It talks about, this is Anna and Clara, so there. All the different tensions and then how to get in front of them and what to look for, right?
Okay.
And so we start with like tensions, which is really important to understand all relationships, all tensions, and how to address the power dynamics. But then you continue through, eventually, to getting there. There we go, page 63.
Okay.
And this is where I was really enjoying.
Cultivating and capturing?
Yeah, the value of community, and it's using a social capital framework, and it talks about bonding networks.
Oh, that's so important.
And social capital. So what I really want to take a moment and talk about here is one of the really nice things that I loved about this report is that we were able to pay people with lived experience, participants, to be a part of our project from the beginning to the end. It was not just, come talk on stage or just give us a few thoughts. They helped us think about the design of this project. We heard things that we would never have understood and it's all represented in this chapter as well and throughout the report. And so one of the things that we learned, or I learned from this, is that people with a lived experience who are going through the food as medicine experience, right? Many of them are going through their own health trauma, right?
Absolutely.
Because there's some major health crisis,
Absolutely.
right? And probably it's, it triggers many other things. It's usually not one, it's multiple. And the relationships, partnerships of building relationships with other people within the food as medicine program.
Yep.
And the bonds and, sharing and collaboration. And I have not seen a ton in just that partnership model of people who are going through, the food as medicine program and what their partnerships look like, with each other, with a community-based organization, if it's being sponsored by one, whether in some of them they're going to actually a farm, like Trinity Health Plan, they actually have a farm and the participants are going to the farm and meeting the farmer. I don't know if you've seen that model, Trinity, and it's all through the health plan and it's like with electronic health records. And so there's many different ways that the participant can be evolving and participating in the project. And so it talks about the different kind of social networks and bonding networks that are important to food as medicine. So that's what this section also addresses.
Okay, awesome.
So
I feel like we covered it
I think
at a high level.
Yeah. So the last thing to know is on the website.
Yes.
But you have to scroll down to the very bottom of the website.
Okay.
On the bottom of the website, do you want to go to the website real quick?
Yes, I can. It is here. I just have to get out of this one screen, which I can.
And when you scroll down to the bottom, there's two really important things you need to see.
Okay.
All right, scroll. There you go. Keep scrolling. All right, stop. Go back up. There you go. So there is a table of the 56 recommendations we said. So if you don't want to read the report every time to find the recommendation and you just want to hold the recommendations in your hand, they're all right there.
Okay. Perfect.
And then the other thing is a stakeholder map.
Yes.
There is the one that you were showing.
Exactly.
So if you just want those,
you can get those two documents versus up here is
you have the executive summary and you have the full report.
Okay, perfect. Because the up here is where you get the full. This you can get the two things, but then that's really helpful because I didn't see that either.
Yeah, because you have to put your name in
all
and
the way
scroll down.
Then you get these.
Yes.
Perfect. Well, we did it.
We did it. This was fun.
This was fun. And I look forward to this was fun because I feel like now we can do a full length. We have Carter.
Yep,
We
and
can
we'll have
really
Anna.
just Anna, and then we can just really dive into. I think that implementation of it and how do we push this forward and just some of the more innovative thoughts around it. And with Carter involved, you never know. So, anyways.
All right, this has been really fun. I'm glad that everyone can experience.
Yes,
cornhole
exactly.
Pickleball is actually happening now behind us.
Oh yes, the same cornhole participants are now playing. This is the first time I've seen anyone play pickleball.
Well, I didn't walk this far because I have a broken foot.
You have a broken foot.
So it was actually nice to see the other side of the conference center.
Exactly. So, all right. Well, thank you, Holly.
Thank you, Ellen.
All right. And thank you, everybody, for joining us.